Hello, my name is Cindy Ronquillo and I'm going to talk about comparing the predictive factors of salivary alpha amylase and dental anxiety for intraoperative pain in patients undergoing dental extraction. The definition: the component with the highest concentration of protein containing saliva is salivary alpha amylase, which is secreted by the pancreas and salivary glands, both enzymatic in nature. Salivary alpha amylase has multiple functions, organized into two biological categories. First, enzymatic function or hydrological activity responsible for the degradation of starches into polysaccharides. Second, binding to the enamel surface or hydroxyapatite.
Alpha amylase is an enzyme that is required to break the bonds within starch. Starch is made up of glucose molecules that are joined together with hydrogen bonds that are called alpha bonds. They're actually alpha 1,4 and alpha 1,6 bonds. And the enzyme alpha amylase is absolutely essential to cleave these bonds, releasing the glucose molecules, and in that way improving starch digestion. The addition of alpha amylase to dairy rations has been shown through trials to increase yields of milk, components including fat and protein, and all through improved starch digestion.
The applications in odontology. The concentration of salivary alpha amylase has been shown to increase rapidly during dental anxiety in patients undergoing dental extraction since it relates, like that of other salivary components, is regulated by the autonomic nervous system, in particular by the sympathetic nerves. The patient being subject to nerves and anxiety begins to produce more of this protein.
So here's a typical setup for surgical extraction and bone grafting. Here I'm freezing the patient with buccal infiltration. This is tooth number 1-1 that we're going to be extracting. We're using a straight forceps. You'll see that I'm twisting before pulling. With the twisting motion breaks the PDL attachment, just like you see in your upper right hand corner there. The twisting motion, then we're going to apply traction, a traction force to pull the remaining root out. And I'm using a curette just to clean up any granular tissue. Just cleaning up the socket, suctioning, rinsing with a sterile saline solution. She's just gonna bite on gauze right now while we take a CBCT, which is right there. So here we're packing in granular bone grafting material, which is cortical cancellous bone graft material, and I'm condensing it as well. We're using that condenser and then a syringe to deliver the bone graft material to the socket. Here I'm suturing. We've already added a collagen plug, and so we're just suturing over top of that. This is like a modified kind of mattress suture that I like to do for socket preservation, bone grafting procedures such as this, and that's it.
The pros and cons. The pros. Salivary alpha amylase contributes to the purification or cleaning of some microorganisms by binding to this protein in a soluble way, signs during swallowing or brushing the teeth. These microorganisms can be eliminated from the oral environment, which is beneficial in immunity of the oral mucus. The cons. The glucose released by the enzymatic action of salivary alpha amylase can be used as a food source by the bacteria that make up dental plaque and then metabolized by themselves to lactic acid, which will ultimately alter the healing process after tooth extraction.
Amylase. How it works. Amylase acts as a catalyst for digestion. It breaks down starch in food, breaking it down into smaller carbohydrate molecules. The enzyme is made in mouth and pancreas. Salivary amylase. Amylase is first secreted in the mouth. As saliva mixes with food, amylase begins its work. Starch is only partially broken down and the remainder of its digestion resumes in small intestine. Pancreatic amylase. This is where pancreatic juices containing other digestive enzymes are released. Starches and sugars are broken down into maltose and then converted to glucose in bloodstream, which is used for energy.
And conclusion. In conclusion, there is an increase in saliva alpha amylase during the dental extraction procedure because the patient is nervous and anxious and cause the central nervous system to emit signals through the sympathetic nerves and this produce more protein. Thank you.